As many of you are aware, Pharmaceutical Society of Sierra Leone has been in partnership with Empower School of Health so the partnership mainly is to see how we can collaborate in terms of capacity building for our professionals that we have back home. This is the second of the series of webinars that we'll be holding as part of our partnership agreement. You can remember that we had the very first one where we talked about immunization and supply chain management in the context of COVID-19, and very useful information was shared during those presentations. And today we're here to have our second webinar series of this partnership, and we'll be speaking, or the panelists and moderator and participants will be speaking to career opportunities for pharmacists in global health and supply chain management. So we are also looking forward to have another webinar, which is the third one for this year. That will be the final one for this year, which will be coming sometime in September or October. So for this session today, we will have three panelists, two from Sierra Leone here and one from Empower, and one moderator who will be I say also from our side. So these three people will be coordinating and ensure that the topic is being covered during this period. And 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 also so far we have over 280, almost 300 registrations for this webinar. So we expect and hope to see about 2/3 of those registrations to participate in this program. So registration is not only limited to participants in Sierra Leone, but also participants in other parts of the world and who have interest in supply chain management, and probably most of them could be pharmacists. And also to mention that this webinar will count towards CPD points for Pharmaceutical Society of Sierra Leone members, so which means they are expected to attend and participate on time. So during this session, participants are expected to drop in their questions and comments in the comment section, so for the moderator's attention, and he will bring those questions and comments to the panelists for response. And so I want to thank you all very much for connecting, especially our colleagues connecting outside of Sierra Leone, for taking your time to participate in this webinar, and also definitely on behalf of the National Executive of the Society and the General Membership of the Society, I welcome you all to this session. So I will move forward now to introduce the moderator for this program. Um, yeah, thank you very much. So the moderator for the program is currently the dean for the Faculty of Pharmaceutical Sciences, College of Medicine and Allied Health Sciences. Allied Health Sciences is a very proactive and pragmatic person. So he's a member of a number of committees, giving his contribution towards pharmacy and pharmacy education generally within the Sierra Leone context. He's a member of the Ethics Committee for Commerce. He is also a member of the Drugs and Therapeutic Committee for District and Hospital Health Management Team. He is also a member of the Senate for the University of Sierra Leone, and also a member of the Country Coordinating Mechanism for Global Fund. And he is also a member of the University of Sierra Leone Courts and a member of the Senate as well for the University of Sierra Leone. He is the chairman for the Education Committee in the Pharmacy Board of Sierra Leone. He holds a PhD and an MPharm from Russia, and a PharmD from the University of Benin in Nigeria. It gives me pleasure to introduce to you the moderator, who is no person but Dr. Mohamed Bawo. Thank you very much. Over to you, Dr. Bawo.
Good morning, all colleagues. Thank you very much, Dr. Bangali, for that introduction. And I want to welcome everybody as Dr. Bangali has just given you the background of our webinar for today's session. Before now, we had the first one, which was on immunization and supply chain management. And today's webinar is based on also supply chain management we had, as he said. Now, before we start, I want to kindly ask colleagues to follow up some housekeeping announcements. First of all, you kindly mute your mic and turn off your video. Please ask questions using chat box and raising your hand. You can see the icon on the right hand side. You please ask, you please participate in poll so we know more about your interest. Webinar recordings will be available in Empower School of Health YouTube channels. The slide deck will be shared with all participants in this. You please turn on your camera for a better engagement. Please mute your microphone when the other speaker is speaking. Please adhere to webinar schedule times. The objective of this webinar today is to understand and explore the career opportunities for pharmacists in global health and supply chain management. By the end of this webinar, the participants will have a good understanding of global careers for pharmacists, including access to medicines, procurement, and supply chain. So rule number one.
Thank you, Mr. Mohammed. So the poll will be launched from the backend. Yeah, here we go. I would request all participants to please put your answers in the respective fields. So we have a brief information about yourself. Thank you. And as you can see, the percentage is still on 0. I would request all attendees, please post the answers. You can see the option in front of each and every question. You just need to select that particular option. And then at the end, once you select all the answers, you can submit your polling. Thank you. Over to you, Mr. Mohammed.
Thank you very much. Now for the poll number one. People are still voting up. Now results are for the first poll number one, about 64% male, while we have about 36% female participation. Age less than 30 is about 21%, 30 to 40 is about 48%, above 40 to 50 is about 22%, 23%, and greater than 50 years of about 7%. Sierra Leone is dominating this session. We have about 68 participants from Sierra Leone. West Africa generally 7%, South Africa 9%, Central Africa 4%, elsewhere is about 13%. Looking at the academic background, we have about 20% pharmacy technician, pharmacy bachelor degrees is about 36%, pharmacy with an advanced degree is 32%, with PhD is about 4%, non-pharmacy 2%, and others we have 7%. Year of experience, less than 5 years, 32%, 6 to 10 years, 29%, about 15 years, 20%, and over 15 years is about 20%.
Thank you so much, Mr. Mohammed. I would request all co-hosts, please do not touch the polling. This polling was incompleted because somebody has stopped the polling in between. Please do not touch the polling session in the next polling round. Thank you. Thank you, Mr. Mohammed. Now I'll be taking care of the session from here about Empower. My name is Sonia and I'm a part of Empower from last 2 years. Let me just brief you what exactly Empower do, what our speciality, what the major fields we are working on it. So Empower is majorly a capacity building organization. We have worked almost over 100 countries across multiple languages to strengthen the original institutional HR capacity of global health and humanitarian program through digital learning intervention. We almost reach to nearly 1 million hours of capacity building content across 2 lakh public health professionals globally. You can see our focus area is on leadership and change management, digital learning, public health, procurement, and supply chain. And 5 are our domain areas, as you can see on the below. On the left-hand side, these are our clients, USAID Global Fund. So these organizations, we have already worked with them or are currently working with them. This is our global presence. As you can see that in Sierra Leone, we recently collaborated in the region. So this is one of the partnership and we are working on more. As informed earlier, this is the same. This is the partner client and funders of Empower School of Health. This is the advisory and faculty member. Professor Paul Lalwani is the Empower director. Dennis Brown and Professor Andy is one of the panelists for today's webinar. This is list of the courses that we generally offer. We also have a master's program that is under development and it will be available soon. Rest we have PGD course in 2 languages, English and French. This is a 1-year course and it is in collaboration with Kent State University. And rest we have a diploma for 6 months and other certificate courses. We also have some few free courses. So I would request you all to please visit our website to have a look on those courses. Thank you so much. Over to you, Mr. Mohammed.
Thank you very much, Sonia. We have poll number 2. This is talking about our previous experience in pharmacy practice.
Thank you all participants for your participation. Till now we have 60% of voting. I would request rest 40%. Please put your answers so we have more information about this particular polling.
So for the responses, we have about retail pharmacy, you have about 9%, hospital, clinical pharmacy, you have 28%, industrial pharmacy, manufacturing or quality assurance, we have 2%, pharmaceutical sales and marketing, 9%, government, MOH, public health programs, any area, 33%. You have health supply chain in country or globally, is about 19%. Type of organizations, personnel working for, MOHS, 58% greater, UN organization or NGO, 8%, private sector, 23%. Academia, 9%, not working right now, 0%, others is about 2%. Previous worked in health supply chain, no, about 28% are saying no, 72% are saying yes. I think we are done with that. Now we want to start with our panelists. We start with the first panelist. He's Dr. Moses N.P. Batsema. Current position, he's presently the Deputy Managing Director of the National Medical Supplies Agency, Pharmaceutical Supply Chain Management Entity in Sierra Leone. A registered pharmacist of 21 years of post-graduation experience. 15 years full-time pharmacy practice in patient care focus roles. He has also spent 13 years in varied practices roles in Canada and 5 years in Sierra Leone. He was pharmacy manager in a busy care setting in Ottawa, Ontario, Canada, and staff pharmacist for several years. An advanced pharmacy practitioner with unique knowledge and skills in ambulatory care sensitive conditions, ACSCs. A strong health provider with a solid research background. He holds of a research-based Master of Science, Pharmaceutical Sciences degree, and a professional Doctor of Pharmacy education, both from the University of Toronto and Canada, graduate from Commerce USL, BPharm Honors Program, a trained and qualified teacher of chemistry and biology with a BSc degree, education degree from Njala University College, USL at the time. So ladies and gentlemen, here colleagues, our panelist, Dr. Moses Batsema, help me to welcome him to the podium. Dr. Batsema, please.
Thank you very much, Dr. Bauer. I hope I'm loud and clear.
Yes, certainly. Very loud, very clear.
Yes, yes, loud and clear.
My own perspective of career opportunities for pharmacists in global health and supply chain. And I would actually like to focus the perspective from the point of view of the organization for which I currently work, that is the National Medical Supplies Agency here in Sierra Leone. So when I was given this opportunity to do this presentation, I spent a lot of time thinking about how do I want to couch this conversation. And in my opinion, I thought that, well, it's an interesting space. And as you recognize from my CV, it's a relatively new space for me too. But I said, first of all, maybe I need to make the professional case why pharmacists need to be recognized and engaged in global health and supply chain. And then go ahead and talk about the competencies that I feel are required for pharmacists to participate in this space. And then look at generally what the global opportunities would be. I would spend a little bit of time, because this is where my experience, my current experience actually plays a role. I'll spend a little bit of time talking about NMSA's perspective of how pharmacists could actually be involved in this space. And I'll conclude with a few comments at the end regarding how pharmacists generally should be involved in global health issues generally. Next slide, please. Next. So I'd like to start by saying that we all may be aware that the global agenda now is shifting towards the Sustainable Development Goals. And I am confident, and I can suggest confidently, that pharmacists are actually primed to contribute in particular to the Sustainable Development Goal number 3, which talks about good health and well-being for all. And the question to me is how? And I'd like to suggest that there are really key areas of global public health through which pharmacists could be recognized and be actively engaged. For me, these include the rational use of drugs, and they will obviously not be limited to that, but medication safety issues and supply chain management in general. One fact is very clear, and globally this is a fact, and it's been validated by a number of studies, that pharmacists are trusted healthcare professionals, primarily because they are one of the most accessible healthcare professionals. And in most cases, actually, they are often the first professional individuals seek for care. And this is especially true in vulnerable settings where there's a lot of vulnerable population, like resource-limited settings, as Sierra Leone, for instance. And the reason is pretty simple. Pharmacists usually have to open longer hours. There usually no appointments are necessary for you to see a pharmacist. Consultant fees are not the norm in these settings. So the point I'm making is, as pharmacy moves from being a product-centered profession to a more patient-cared service, where we will be concentrating on preventative screening, immunization, disease state management, more attention is now shifting to how pharmacies can impact on public health. And this is where I feel that the discussion is focused for today. Let's move to the next slide, please. So in developed countries, pharmacists are already increasingly recognized in public healthcare activities, whether it's disease prevention and control, whether it's policy formulation development, whether it's emergency preparedness. They are already being actively involved. In fact, I'll go further to say that organizations such as the CDC, the Public Health England, Health Canada, WHO, they are all encouraging community organizations and other healthcare professionals to partner with pharmacists for effective planning of public healthcare services. Unfortunately, in our own settings, like Sierra Leone, for example, there has not been a comparable endorsement or utilization of pharmacists in this space. So an opportunity exists for pharmacists to be involved not only as healthcare providers, but in global health as well. So whether it's from medication safety issues to the responsible use of medicines, to supply chain management, to immunization, pharmacists, I believe, have the unique medication expertise, not only to address these issues and local gaps, but to be recognized in public healthcare activities. Next slide. So in 2011, there was the People That Deliver initiative, and this was formed by the International Pharmaceutical Federation, which was one of its board members. It was actually a global partnership that was trying to implement evidence-based approaches to planning issues around effective supply chain management. They identified 6 key domains of supply chain competencies. And I feel like this fits into the kind of competency that is required for pharmacists if they are to find their foot in this space. And these competencies were divided into 2 key sections, technical as well as managerial. In terms of technical, pharmacists' competence will be required in areas of selection and quantification. Select and quantify the correct supplies for their work situation, whether it's in a country setting, at a district level, or at a facility level. Procurement. Competencies are required for you to be able to procure and supply the drugs that are needed in your setting. Storage and distribution. For you to be able to store and distribute supplies, for you to be able to move supplies to facilities and send them to other facilities, you require the level of competency that you need to be able to carry out that important component of supply chain work. And drug utilization. If there is any other area within supply chain where pharmacists are going to be even most needed in terms of expertise and competencies in the area of drug use. And generally around management issues regarding resource management or professional life management. So these are key competencies that pharmacists require. And so in my next slide, which I'll request that you pull up, what I have tried to do is to just highlight some of the top global supply chain issues that exist in any supply chain setting and where pharmacists can easily plug by way of career opportunities. I mean, there are management issues around coordination of supply chain activities, which is what some of us already do as a pharmacist in the organization that I work for. But inventory management issues, these are areas where pharmacists can plug in. Demand information, supply planning, and forecasting. These are areas where pharmacists can play an important role. Order management, especially when in our current supply chain posture, we are trying to transition from what I call a push system to a pull system. It is important for pharmacists' skills and expertise to be utilized in how orders are managed. Stockouts, this is a common norm, especially in resource limited settings. But pharmacist expertise can be used to be able to manage situations like that. Expiries, warehouse management, temperature control, pipeline monitoring. These are all areas where I think that career pharmacists can easily plug in and their skills will be really excellent. Next slide. So at this point, I'd just like to segue into what we are doing here in Sierra Leone. So the organization that I work for, which is the National Medical Supplies Agency, was actually created by an act of parliament in response to some of the supply chain challenges that exist, operational as well as managerial. So the 2017 NMSA Act created the exclusive responsibility for this agency to do some of the key components of supply chain work, procurement, warehousing, and distribution. So we do that for and on behalf of all public institutions in Sierra Leone, with the vision that we want to be a sustainable and reliable public sector health supply chain provider for this country. So we want to ensure in our mission statement that we are increasing access to affordable, effective, safe, and high quality health commodities for us to be able to enhance effective service delivery in the area of health in this country. And so we are anchored on some key operating principles and core values that are general to effective organizations. And so in my next slide, you will notice that I have just highlighted some of those key operating principles and values that we espouse in the agency. Supply chain management control, we want to be able to do that very effectively. Improve procurement processes, standard storage capacity and quality, distribution expertise, as well as managing the fleets that distribute these products to our facilities. Quality assurance, IT in this day and age, continuous quality improvement. These are all critical areas where pharmacists can actively plug. And we are designing our agency to be a pharmacist-owned agency so that in all of these processes, that expertise can be brought to bear. And obviously, these operating values carry us through ethical integrity, which is the hallmark of any healthcare professional, accountability, sensitivity to societal needs, customer orientation, value for money, and the concept of teamwork. These are all values that pharmacists have acquired in their formal training, which we believe will be really important to the work that we do as a supply chain entity. In the next slide, the next slide just presents an overall policy and legal framework of how supply chain operations are happening currently in Sierra Leone. And in fact, that even also informs how pharmacists are already plugged into supply chain work and could empower themselves in the future to even plug in more. So there are two entities that run supply chain work in Sierra Leone. There's the Directorate of Pharmaceutical Services in the Ministry of Health and Sanitation that is essentially concerned more with selection, quantification, and drug utilization reviews. So pharmacists, again, can actively plug in this area. Now, from our vantage point, I've already explained that NMSA, we do procurement, storage, and distribution. So in my next slide and in my concluding comments, the point I am actually making in this short presentation that I have made is that pharmaceutical systems across our resource-limited settings worldwide need to be strengthened if we are to actually achieve the broader goals of the global health agenda. And I believe, and I'm sure most of you will be convinced, that pharmacists are the medication experts that can help contribute to these global health areas by strengthening our systems across all levels. But also, in doing that, we must take action to enable pharmacists to serve in this capacity through training programs or through including some aspects of supply chain management in our pharmacy curricula. So that as pharmacists continue to gain recognition of their role contributing to health of our communities, there will be expanded opportunities for pharmacists to reduce our health disparities in the world generally and achieve good health for all. So at this point, I would anchor at this point, and maybe during our question and answer sessions, we can dilate on some of the issues that are not quite clear or were not better explained. Thank you very much for the opportunity.
Thank you very much, Dr. Batima. And I hope we have the chat box. Whenever we think we have questions, let us please focus on the chat box to have our questions there. Later, the panelists will respond. I will now call on the next panelist. He's Professor Andy Baraclough, Global Health Supply Chain Expert. Briefly, he is the Professor of Public Health and Director of Training at the Empower School of Health. Andy is one of the co-authors of the Yellow Book, Managing Drug Supplies by MSH and WHO, and the e-handbook of Health Systems in Action. He has over 30 years of experience of working with major international funding institutions and bilateral donors in low-income countries. The main focus of previous experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of new medicines and rapid diagnostics for neglected tropical diseases. He has undertaken donor-funded activities in over 40 countries, from provision of family planning commodities and the responses to the early onset of HIV in the 90s. Through the Global Fund grants in the 2000s, essential medicine provision in conflict zones, and extensive training in the quality of medicines. He has most recently authored the Guam Supply Chains for Emergency Response COVID-19 platform, Pandemic Preparedness Training Modules. Ladies and gentlemen, please let us welcome our Professor Andy Baraklov, Global Health Supply Chain Expert. Welcome, Prof.
Okay, thank you very much, and thank you so well for pronouncing my name correctly. It's a difficult one. Thank you. Okay, so what is the role for pharmacists in global health procurement and supply chain? Next slide, please. Why would you consider a career taking part in this procurement and supply chain? Well, one of the key points is to look at the global situation. Nearly 2 billion people do not have access to basic essential medicines. That's around 1/3 of the world's population. What use is pharmacy if people can never get the medicines? They don't have access because the supply chain is failing. Next slide, please. These supply chain failures have been present for a long time, but most recently they've been recognized and people are willing to acknowledge them a lot more. We have this statement from the former World Health Assembly Director General-elect: all the donated drugs in the world won't do any good if I can't deliver them to the patient. I have to be able to get them to the patient, otherwise I'm not succeeding. Next slide, please. One of the major reasons why we have these challenges is the lack of human resource capacity. We estimate that in the procurement supply chain in the public sector in low-income countries, there are 30 to 70% vacancy rates. We don't have trained PSM people. They're not available.
Yes.
Next slide, please. And just to confirm this, the Global Fund says that we are not achieving the Sustainable Development Goals. And one of the reasons we're not achieving it is because the supply chain is not working. And the key reason it's not working is because we've got these vacancy rates of 70%. We have no staff, and then we have underqualified staff or staff with only a little bit of training. And this impacts throughout the whole of the supply chain. It means we can't move forward on the health development at the rates we would want. On the people that deliver websites, you'll find a full story of how underqualified public health supply chain staff leads to poorly managed and inefficiently resourced chain. We get poor availability of commodities, and we don't get health progress. Health programs are failing. We're not achieving the malaria rollouts. We're not achieving the antiretroviral and tuberculosis rollouts that we want because supply chain is failing. And this puts an enormous strain on the people who are working now in the supply chain. They have to work with this serious understaffing and with the lack of training. Next slide, please. So why is there no human resource capacity in healthcare procurement and supply chain management? Well, very few schools of pharmacy teach procurement and supply chain management. And I don't know of any management schools that teach pharmacy. So we're not bringing the two together. There are a few exceptions. All schools of pharmacy in Vietnam, by government edict, must teach procurement and supply chain management as part of the course. But generally, few schools of pharmacy teach any serious amount of procurement and supply chain management. So pharmacists have got an excellent pharmacy background, but they don't receive much training in procurement and supply chain management as part of pharmacy. The health supply chain needs pharmacists, but pharmacy alone is not enough. It needs pharmacists who are also skilled and trained in procurement and supply chain. Next slide, please. So how do you get this training? How do you become knowledgeable in healthcare procurement and supply chain management? There are a series of 3 training courses, which will help you with the introduction, which will give you the understanding of the outline. There's the UNDP course, which was written by Empower. It's available online. It's completely free. The links are on the screen, and you will see the slide deck to follow the links. There's the Global Fund, also written by Empower, Financial Evaluations in Investments in Public Health Supply Chain. And for those interested in COVID products, people who may already have some PSM training but want to know more about COVID products, there's a whole series of training programs which I'll speak to on the next slide. Paid courses, of course, there is the Empower course, which is a 1-year course in global health and supply chain management. That's the postgraduate course. And there's also a shorter 6-month course. Those are on the links that have been given you on the Empower courses. Coming soon to Empower, the master's degree course in healthcare procurement and supply chain management. Next slide, please. For those who want to know more about COVID, and again, I think very few pharmacists have been trained in personal protective equipment, but suddenly the whole healthcare supply chain has got to handle massive volumes of personal protective equipment. So if you wish to know about this, then there's 3 online training courses available written by Empower under the GOAN, that's the Global Outbreak Alert and Response Network. They were primarily written for Southeast Asia, but they have general application for the world. They're open to anyone, they're free, and they're online courses. Next slide, please. So who are these courses for? Pretty much for anyone who wants to take part in procurement and supply chain management of healthcare commodities. That really requires that you either have some kind of healthcare background. Pharmacy is excellent, but it could also be nursing and even clinical medicine, or that you have a serious management background and are willing to understand more about technical healthcare issues. Courses are generally available in English and French. The UNDP course is available in 6 different languages. You need to be able to commit about 25 hours per month over a period of about 11 months. So it's quite intense, it's quite serious, but you can do it while you're still working, you can do it while you're still at your job. You need to have at least a bachelor's degree to enter the course. Prior work experience in PSM is preferred, though not absolutely essential. So there's a wide range of people we take into the courses, not just pharmacists. We've had a large number of doctors and other professionals as well take part. Next slide, please. Large number of agencies or stakeholders, they all want procurement, supply chain management people. Huge number of organizations, donor organizations, and implementing organizations across the world. I'm sure many of them are active in Sierra Leone. Next slide, please. So one of the messages is the supply chain is important now. It's about to become a lot more important in the future. If we look at the development of the new products coming along, we have over 200 vaccines in development, 200 different types of vaccine. We have over 90 new diagnostic kits, over 80 new medicines in development, and over 50 other items. It's a huge burden. It will massively increase the volume of products. They're all new products. They'll all require special handling, special conditions. That means having availability and knowledge of pharmacy and healthcare products to be able to manage them correctly. Next slide, please. I think there's one more on this screen to come. Yeah, a total of over 436 products in development right now that we expect to come through the pipeline in the next 2 to 3 years. Most essential medicine lists are around 400 items. we're talking about doubling the volume of items we're handling in the future. Who are the major players? Well, these are the people with the money. So they become the major players. And we follow the golden rule. I'm sure you all know what the golden rule is. The one with the gold, they make the rules. And we start with the biggest one, Global Fund. They mainly handle HIV, TB, and malaria, but other areas as well. They're particularly focused on that field. Massive developments taking place in those areas, particularly with multiple drug-resistant TB and how to address that. Bill and Melinda Gates Foundation, lots of activities in strengthening healthcare systems and especially supply chain. JICA, USAID, UK Aid, all the bilateral agencies always supporting this area. And of course, the global agencies like UNDP, WHO, UNICEF, UNAIDS, also all looking for supply chain staff. Next slide, please. Who are these major players? Well, if we look at Global Fund, they invest about 4 billion per year and support more than 100 programs run by local experts. So Global Fund don't employ people, they finance the country to employ people. And they're in partnership both with country programs and with NGOs and civil societies and agencies within countries. A number of countries, UNDP acts as the principal recipient for the Global Fund grants and manages the situation. The main point is it's a huge area around AIDS, TB, and malaria, lots of commodities, diagnostics, as well as medicines, but especially new medicines emerging, particularly as we look at malaria vaccines in the future. Next slide, please. Bill and Melinda Gates Foundation invests in system strengthening. Neglected infectious diseases, neglected tropical diseases has been, as the name says, a hugely neglected area. But there are around 40 new medicines in development for neglected tropical disease. Shortly, we'll be able to address these areas. We'll be able to treat people economically. And that means we have to have a supply chain that can function. And that requires trained and skilled staff. Next slide, please. Are there really jobs? Is it genuine? Well, if you have a look at the UN Jobs website, just go to the internet, look at UN Jobs. Here's just pulled off in the last couple of days, logistics officer, procurement and supply officer, Sudan, Kampala, all around the list of people are there. If you just enter pharmacist, you'll often find supply chain jobs coming up as well. Next slide, please. Jobs with implementing agencies like Management Sciences for Health. Here you can see a list, you can see the dates, they're current, there's times on them, yeah. For jobs in all sorts of areas, especially conflict zones. Bamako, Afghanistan, Nigeria, yeah, across the world, there are openings and positions for experienced supply chain staff there. So there really are job opportunities. It's not easy. You don't walk into it just by being a pharmacist. You have to have skill, training, and experience in procurement, supply chain management to get these jobs, but they are available. Next slide, please. Global health procurement offers real career opportunities, but it requires that you go beyond pharmacy and undertake training in procurement and supply chain management. I would say at the very least, it's a role that should be considered. And FIP, the Fédération Internationale Pharmaceutique, the International Federation of Pharmacy, also recognizes the vital role of pharmacists in the supply chain. That ends my presentation. I'll be available in the Q&A session to answer any questions. Okay, I can hand back over now to the moderator.
Thank you very much, Prof, for that brilliant presentation. Please, participants, we have our chat box. Send in as much questions as you could for every participant. Please indicate the name of the participant whilst you are sending your question. Our next panelist is a colleague, pharmacist. He is pharmacist Mada Sankpakra. He is currently CEO, Premium Pharma Consultant and Victory Healthcare Limited, former District Logistics Officer, UNICEF, former Acting Regional Logistics Officer, Southeast, UNICEF, former Logistics Coordinator, National HIV/AIDS Secretariat, Global Fund Project, former Commercial Sales Lead, Maristopes Sierra Leone, former Managing Director, Medis Solutions Limited, and entrepreneur. A very ambitious gentleman. Please let us welcome our next presenter. Welcome, sir.
Thank you very much, Dr. Bawa. I'm pleased to be here this morning. Our topic is career opportunities for pharmacists in global health and supply chain. The two previous speakers have done justice to supply chain, which is one of the key areas where pharmacists have a critical role to play in impacting public health as well as global health. So I would like to spice it up a little bit with two other thematic areas which the first speaker mentioned, and intersperse it with my personal experience as well as bringing in the private sector perspective. So basically that's my angle I'll be coming from. Next slide. Next slide, please. Hello? Okay, so I started off my career as a medical rep.
Mr. Mada, I'm so sorry to interrupt you in between. Actually, there is an echo in your room, or your voice is very much louder, so we can't hear you properly.
Okay, so maybe I'll just open up the door. Is it okay now? Can you hear me now, please?
Your voice.
Yes, Mada, we can hear you, but if you can move a little bit away from your computer, probably it's
okay, so can you hear me now? Moved.
It's too loud. It's too loud. So maybe you move away a little bit from the mic.
Okay. How about this?
Yeah, go ahead.
Is it okay? Okay, fine. So, like I said, I would look at two other thematic areas where pharmacists can play a significant role in enhancing global health, because the two initial speakers have, spent a good time talking about supply chain management and they've done a pretty good job. So I would like to look at two other thematic areas, and I'd like to bring in the private sector perspective as well as my experience as a pharmacist. So, like I said, I started off my career as a medical rep with a pharmaceutical company, and then moved on to work as District Logistics Officer for UNICEF, then Logistics Coordinator with the National HIV and AIDS Program, and then I went to the NGO sector and worked as Commercial Sales Lead. Maristopes is basically a leader in providing reproductive health care. So you will see that I have a fair share of my experience working in all the sectors in the industry, public, private, and not-for-profit. Next slide. So I want to look at two thematic areas where pharmacists play critical role. The first is with the rational use of medicines. Okay. Rational use of medicines is ensuring that patients as well as providers use medicines in the proper way. Improper use of medicines is basically given a huge burden to healthcare. I mean, we can imagine antimicrobial resistance because of the irrational use of antimicrobials and the huge sums of money that has been lost because of irrational use. Pharmacists are particularly positioned, and we have the competence, the expertise to be able to reduce that burden, to be able to improve on the rational use of medications, which would ultimately enhance or improve on public health and global health as a whole. So let's look at the private sector and particularly look at what happens or what should happen at the community pharmacy level. So the literature is clear that the pharmacy is the first port of call for people who seek healthcare, because pharmacies are widely distributed in the communities. People don't need consultations, they don't need appointments to seek care. So it becomes the first port of call. So at that level, we have a key role as pharmacists to be able to provide adequate information on the proper use of medicines. Apart from that, there are a lot of other interventions that can be carried out at the pharmacy level that would help improve therapeutic outcomes for patients. So if you look at things like if you look at things like tobacco cessation programs, you look at immunizations, you look at counseling for lifestyle modifications, etc. These are things that could be done at the community level pharmacy that would help transform and impact health outcomes. As a medical rep, I spent hours moving in between pharmacy outlets and community. And it is without doubt that there is a huge gap, but also a very potent opportunity for pharmacists to develop their careers. We all know that oftentimes you go to a pharmacy, you really don't find pharmacy professionals. So our career, our jobs are actually being left to non-pharmacists to do. Now I see that as an opportunity, because if we are able to take up our responsibilities as pharmacists at the community level, then the awareness, the image of pharmacists will be transformed. And that would help increase on our acceptability as very key healthcare providers in the healthcare delivery system. So that is a significant area, and that is a significant opportunity for pharmacists. I feel pharmacists have the opportunity to start their own businesses, because it's obvious that if you own a business, a pharmacy, you 10 chances to 1 will be present in that outlet, and you will be able to provide the much needed services instead of just dispensing products to patients. we have the intellect, we have the expertise to provide requisite information, correct information, whilst dispensing. So pharmacists have the opportunity to own pharmacy outlets. They have the opportunity to partner with individuals to run and operate pharmacy outlets such that the much needed services can be delivered at that level. I want to say in Sierra Leone, we have some model pharmacies owned by pharmacy professionals that are providing these services, these much required services. For example, disease screening, there is a particular pharmacy, City Globe. They've actually been known now for providing disease screening, particularly hepatitis B and diabetes management. So you go to an outlet like that, you are able to access information, relevant information about your disease. You have been able to screen properly, and at that level, a lot of patients get diagnosed before the disease progresses to a very bad state. So I think there's a huge opportunity for pharmacists to own and operate outlets like those, which would in all boost the image of pharmacy professionals. I want to also mention that pharmacists have the opportunity to transform the mindsets of the patients, of the community. For example, when I started as a pharmacist, working as a medical rep, I had a lot of interactions, well, the opportunity to interact with doctors, nurses, and even non-pharmacy professionals or non-healthcare professionals that worked in the pharmacy setting. And you will realize that there is a unique opportunity there to change behaviors and even to influence policy change. So when I started, malaria was being treated with artesunate. The company I worked with introduced artesunate and amodiaquine, and it took a great deal of work to convince people that malaria treatment was to be done with a combination therapy rather than monotherapy. So gradually people started changing the behaviors. Prescribers started prescribing the artesunate and amodiaquine combination. But then this combination had lots of side effects. In as much as it was very efficacious, there were lots of side effects with it. So we decided at a very strategic level in the company to introduce the Artemether Lumefantrine brand. Now that brand was more expensive than the regular artesunate and amodiaquine or even the artesunate combination. But because the therapeutic outcomes were better and the side effects were lesser, or I mean, obviously the side effects were even nil, a lot of people started using the more expensive artesunate lumefantrine combination instead of just buying the artesunate. Now, what eventually happened was there was a very huge acceptance of this product, which made a lot of other importers start bringing in different brands. So our company was very instrumental in changing that perception, and we were able to force to introduce the Artemether Lumefantrine combination even before the government. So as pharmacists, we have a unique role to play in also changing this policy. Like, remember, we tried to influence the incorporation of misoprostol into the essential list, but that did not happen because government was afraid to bring in misoprostol for the obvious reasons we know. But then down the line, a couple of years later, misoprostol was incorporated into the essential list. And while I worked with Mario Stopes, I did a lot of work promoting that product for treatment and prevention of PPH, PAC services, etc. I was marveled that even medical doctors did not know the correct indications, they did not know the correct dosages for the various uses of misoprostol. Meanwhile, misoprostol is a very useful drug that could be used for treating and preventing PPH, which is one of the leading causes of maternal mortality in Sierra Leone. So as a pharmacist, my work with Mario Stopes was to change the perception that people had about misoprostol and also influence the policy for misoprostol to be incorporated into the essential medicines list. So when it comes to rational use of medicines, pharmacists have the unique skills. They have the requisite training. And so we have to own that space. We have to get into the community pharmacies and change the narrative so that one, people will see us as very useful members of the health delivery system, as well as create a much needed impact for public health and global health as a whole. So that is my perspective on rational use of drugs. I'd like to throw a little bit light on medication safety, which is another unique area for pharmacists to intervene. I normally don't like to mention that I spent 6 months of internship working in the quality control laboratory at Pharmacy Board. But thinking about that, I realized that at that point, a lot of work was done to ensure that the medicines that came into the country were safe. When I started, or even before I graduated from the medical school, from the pharmacy school, there were lots of issues with respect to fake and substandard drugs in the market. But that changed over time when we had the Pharmacy Board of Sierra Leone build the capacity that was then in the quality control department and incorporate human resource. Now I know that today that quality control department needs a lot of human resource. I believe that up to about 80% of the staff working in that department are non-pharmacists. This is a unique opportunity for pharmacists, and it's an area where pharmacists would help change public health outcomes, because it would mean that more and more of the drugs that come into the country meet the requisite quality standards and ultimately would have the therapeutic benefits that are required. So I see quality control as an area where pharmacists come in. So quality control, quality assurance for pharmaceutical systems, across pharmaceutical systems, can be strengthened. And pharmacists are more suited. Well, I mean, we are the qualified people to ensure that pharmaceutical systems are strengthened and are resilient. Because if the pharmaceutical systems are not strengthened, things like supply chain would fail, the safety of medicines and the circulation and the public and private sector will be questionable. And a lot of things would happen that all would contribute to a collapse in public health and healthcare delivery. So ensuring medication safety is another key area where pharmacists could come in where there are career opportunities, things like pharmacovigilance, post-market surveillance. I know that currently there's a lot being done in that area, but there is also lack of resources, both in terms of financial as well as human resource, to be able to strengthen those systems so that medicine safety is enhanced. So, having said that, I would like to mention that pharmacists can be very instrumental in providing, in ensuring global health, public health is improved. However, a lot of work needs to be done in ensuring that pharmacists have the requisite training. Although we are trained as experts for medicines, but there are other areas that need to be strengthened or rather brought into the curriculum, such as basic public health principles. So when pharmacists graduate and come into the community, they are job ready. You know, they have the skills, leadership, qualities, managerial, some basic managerial skills, so that they're able to properly function within the healthcare system. All of these things put together, ensuring that we have an efficient supply chain, that we have rational use of medications, that we have safety medicines in both the public and the private sector, will come together with other factors to make sure we have a very robust public health delivery, which ultimately transforms to global health. I want to thank you very much, Mr. Speaker, moderator. If there are questions, I would answer to them. Thank you very much. Dr. Bawa? Dr. Bawa?
Okay, thank you. The host was keeping me out. Thank you very much, pharmacist Mada Sampakra, for your presentation. I think now there are a series of questions for all the presenters. We will allow now question session. Please post your questions in the chat box so that we allow presenters to respond to your questions.
Okay, I see there are a series of questions, so if I perhaps start and then the other panelists can have time to look at the questions and take over. If I just look very quickly, perhaps. One is, how do we achieve the Sustainable Development Goals? One of the answers is that we get the supply chain to work. And that means that we have a cadre of trained staff in the supply chain to move it along. It's an area that is being addressed, but it is moving slowly. The importance of supply chain is now recognized. It's highly recognized in the private sector, and it is becoming increasingly recognized in the public sector. So now is the time to try and push that agenda forward, address the supply chain deficiencies, stop the stockouts, get the medicines there. We'll start to achieve the Sustainable Development Goals at a faster rate. One is around the data issues. Yes, the supply chain needs good data, and many of our systems don't have good data. Some don't have any data at all. And we're left to try and estimate using morbidity, quantification, and other techniques the amounts we require, which are not always that accurate. So improving data gathering is necessary. And that largely means moving to computerized systems. Even very small shops now have barcode scanning and point of sale computerized tills. And yet not many of our warehouses do. Almost none of our clinics have that. We've got to move along on the technology, adapting far more technology. We cannot still be collecting data on paper sheets and lined ruled pads. It has to come now to information technology on data collection, and that will improve the flow of data and the reliability of data. Again, that recognition is coming. It's time to try and push that forward as we go. Are pharmacists given preference in hiring and for jobs? That depends on the nature of the jobs. Is medicines, some is health products. How many pharmacists know about catheters or the different types or implantables? So there are areas where pharmacists definitely do have preference, certainly in medicines management. And they can have a contribution in all areas, but the preference tends to be limited to directly medicine management jobs. Are there scope for other health professionals like microbiologists? Absolutely. Absolutely they are. Lab health supply chain, clinical laboratory supply chain is a massive undertaking. We have about 350 essential medicines. There are over 5,000 essential laboratory items. It's a huge undertaking. All lab staff, all qualified lab professionals have a scope to play in the supply chain for clinical laboratory, and increasingly now, as we move to point of care, diagnosis and treatment, the rapid test kits. As we move to those, we can see increasing volumes of lab commodities and need for lab professionals to be involved. How do you get started? You undertake training. The UNDP online course is free. It takes about 2 months. Give it a try. If you're new to the area, give it a try. See how you do. See if it's an area you feel comfortable and happy with. That will get you a start into procurement and supply chain management. Are there special considerations for a pharmacist around vaccines? Yes, certainly vaccine programs look at that. As we're seeing COVID-19 vaccine rollouts, we're seeing the need for experienced vaccine staff. Certainly openings and categories in that area. I've spoken enough. It's time for the other panelists to respond to questions.
I think there is one you need also to respond to. They will go to the other. Is there any chance for pharmacy technicians to pursue any diploma course in procurement and supply chain management? If so,
yes, the simple answer is yes. First of all, you can do the UNDP course. That's open to you as a pharmacy technician. The Empower runs 2 courses, the postgraduate diploma course, 12 months. That really requires a first degree. Doesn't have to be in pharmacy, but that really is a requirement. The 6-month course, not so stringent. We'll look at your experience and background, and it is possible. Not guaranteed, it is possible. We could look at that.
okay, that one is from Dennis from South Sudan.
Okay, a long time since I was in Sudan, probably 2 years, but okay.
Thank you very much, Prof.
Okay.
And yeah, maybe we Dr. Kusema.
Okay, so thank you very much for all the panelists, sorry, and for all the questions. I noticed a couple of questions specifically for me, so I'll try to address most of them, and I might combine a few questions. So the first question I have here is, what 2 challenges has NMSA faced in management and supply chain management in general? Am I loud and clear, please?
Yes.
Okay. So with the challenges, I like to summarize them in two key points. Our key challenges as a supply chain entity in Sierra Leone is financial resources. This is a huge challenge. And I like to suggest that this is not a challenge that is unique to Sierra Leone alone, but it's a general challenge with all supply chain entities, irrespective of where you find them. So that is one key challenge, and I'm pretty sure most of us can relate to that. And secondly, which is the reason why I consider this session really critical, is just the lack of appropriately trained supply chain personnel. And I mean at all levels, whether it's from, particularly for us at NMSA, whether it's from procurement right down to distribution. But I guess we are making significant steps to address those challenges, which I'll speak to in some of the other questions. The next question was, how has the work at NMSA pushed to have the pull and push system coordinated in Sierra Leone, being that PHUs are not knowledgeable in pharmacy and supply chain? Now, the whole concept of transitioning from our predominantly push system to a pull system actually depends on the quality of data, especially around drug utilization and consumption. Now, lots of efforts have been directed towards that through support by our stakeholders and partners in the supply chain, Global Fund, CHAI, Chemonix. As you are aware, Global Fund was really critical in making sure that we have an inventory management system called M-Supply. So they've been very critical in that. The question becomes, has that made any change? I really do not think so. And that is the reason why efforts are actively underway to try to intensify the gains from this system, probably even optimize its use. So right now, what is happening? We are endeavoring to transition. What we are using right now is not a pull system per se. It's something that we will refer to as an informed push, because we are basically relying on 2 data points to be able to supply drugs to facilities. One key data point that we are relying on is on consumption data from DHIS2. Obviously, we have questions about the quality of this data, which is the reason why we cannot 100% rely on them. But also we are supplementing that with facility requests from service delivery points. So we are using a combination of those two, inputting them into an allocation model that we have created to be able to respond to the needs of these facilities. But again, bottom line, resource constraints and human resource personnel issues are confounding our efforts in that direction. The third point is, what would you say are the opportunities we have in making pharmacy key amongst Sierra Leone politics and population? So this is the one area where I have a lot of hope about the opportunities that exist for pharmacists within the supply chain, because the narrative is changing. As you are aware, NMSA is a recently created institution, as recent as 2017, operationalized sometime around 2018. The fact of the matter is that NMSA is a pharmacist-heavy organization. Right from the beginning of the governance structure, our governance structure is created in such a form that the chairman of the board of governors of the National Medical Supplies Agency is a pharmacist, and is actually the president of the Pharmaceutical Society of Sierra Leone. For me, that is a huge opportunity. Also, there are 2 key board members, again from the governance perspective, that are pharmacists, the Secretary General of the society, and another pharmacist member who was appointed to that board as a pharmaceutical expert. So again, huge opportunities for pharmacists to open this space and plug themselves into this space. At senior management level, which consists of 9 colleagues, 4 of these colleagues are pharmacists. The managing director, myself, the director of operations, and the quality assurance manager. These are all pharmacists. At middle management level, we have just appointed a national warehouse manager who is an experienced pharmacist who has been in the area of supply chain, has worked in the area of supply chain for quite a while, has capacitated himself with supply chain courses, as has been mentioned, that is a good thing. Junior pharmacists, we are encouraging them to come on board. At the current time, we have 3 of them on board, and we hope that the opportunity can be created for them to be capacitated around supply chain issues. So slowly, we will make the supply chain entity a pharmacist-heavy organization that will rely on their expertise, but I would also have trained them sufficiently enough to be able to be knowledgeable around supply chain issues. The next thing that I will not comment on much, because Professor Andy has already spoken about that in quite straightforward and simple terms, is the question of data management. I agree that data management is the bedrock of supply chain activities, and there is no question about that. And that is the reason why, for us, we are interested in automated solutions. We believe that we should be moving from these paper-based tools to automated computer-based systems that can provide us with information on the click of a button. M-Supply currently is available only at the central medical stores, the district medical stores, and some hospitals. We don't believe that that is enough. We believe that we should automate the system right down to the peripheral health units, right down at that level. And there are capabilities to do that. But again, the bottom line, it boils down to resources. But again, once the will exists, the strategic will exists, we should be able to work in that direction. And the other question was about the role of non-pharmaceutical staff in supply chain. In as much as we want to populate the supply chain with pharmacists, yes, there is definitely a role for other professionals who have specific skill sets in supply chain. But bottom line, for them to be brought up to speed with some of the technical details of managing pharmaceuticals, they need training, and I like to emphasize that training. And there was a question about rational drug use. It was directed to pharmacist Sampakra and myself. Obviously, rational drug use is critical. Like, if we rationally use our drugs, we are not only able to manage the products that we inject into the supply chain, but we are able to also save resources, because then we wouldn't have several products expiring in our stores and warehouses. And that brings me to the last question, which was about investment of billions in procurement and distribution, yet we don't have basic drugs in the facilities, and drugs are expiring in huge quantities. The problems are obvious. Supply chain is obviously being fixed. I agree with that observation. But again, how do we fix it? Training, properly capacitated staff, and very good tools to be able to monitor the use of these products in our facilities. But also from a policy perspective, our donations policy. These are things that we need to take very good note of and align them with the operations of the supply chain entities. Thank you very much so far.
Thank you very much, Dr. Batsema. Now we now maybe move to the next presenter from Madam.
Okay, I see a specific question directed to me. It says, how would you compare private sector versus your colleague public sector staff? I mean, I don't know with respect to what. So the question is a little bit ambiguous. I mean, with respect to their commitment to work or their presence at workplace, or with respect to, I don't know, the question is a little bit ambiguous. What challenge have you faced as a private sector practitioner? Well, I'm really worried that our practice, our profession is in the hands of non-pharmacy professionals. That is a huge one. So even as you go to communicate with people who working in the pharmacy setting, it's really a bit difficult because even the levels of comprehension is low. If you speak to a pharmacist, it's easier for you to change a particular practice because he understands the basic. So that could be a little bit of problem, and it's a huge challenge for me. The other question was, what would you say about Sierra Leone health system from a pharmacist perspective? So I would like to say that, I mean, a lot needs to be done about the healthcare system in Sierra Leone. Systems need to be strengthened. The systems need to be robust. For me, I feel that if we are to have a solid healthcare delivery system, it means we need the human resource, we need the equipment, we need funds, we need the infrastructure for things to work effectively. And every personnel, every healthcare provider has to have clearly in his mind what his roles are. Everybody's responsibility is clear. So if the responsibility of the pharmacist is clear, then it does not conflict with the responsibility of the doctor or the nurse or the laboratory technician. Everybody works in sync. Everybody focuses on his core competencies so that the team moves together in unison. That will strengthen the delivery system, and I see that a lot of that is lacking. And especially for pharmacists, I know that till today, we continue to struggle for recognition in the healthcare delivery system, and a lot of things need to be put in place so that we can actually provide value to the system. The other question is, what would you change? What would you do to change all these narratives if you were to become the chief pharmacist or the registrar as well? Well, like I said, it's having a system that works. We need the right legislation. So, for example, from the pharmacy point of view, do we have the right legislation? If we have it, how do we enforce it? For example, how is it that we have so many drug peddlers? How is it that if you go to a pharmacy, you will see a non-pharmacy professional or a non-healthcare professional dispensing controlled drugs? How is it that there's a lot of chaos in the system? I think for me, it's a more of advocacy, ensuring that people understand what hazards are there. I mean, when they just irrationally use drugs, and to ensure that pharmacy professionals actually go back into the communities, into the community pharmacies, and do what they're supposed to do. It will be a lot of hard work making that happen, but then if it's clear what you want to achieve, it can be done. So I think that's what I would do. I don't know if there's any other specific question for me here. Okay, so much drugs in the hands of peddlers as an entrepreneur. So I've just said that there is a legislation, the laws need to be implemented. It's clear where drugs are supposed to be by law. So we just ensure that we use the law and use the law enforcement agency, as well as a lot of advocacy and awareness raising, because sometimes people, the average Sierra Leonean, is not even aware that it's not supposed, or it's not the right thing to do to buy drugs from from the peddler. But then what's the difference between the peddler on the streets and someone who is a non-pharmacy professional who is selling drugs in a pharmacy? There's really not quite a difference between the two. So if we want to change the narrative, we have to, as pharmacy professionals, own up to our responsibility. Go back to the community pharmacies. In the wholesale setting, what can we do to ensure that wholesalers don't sell drugs to people who are not licensed to trade in the pharmaceutical business? If the pharmacist is there, engages with a business owner, then we can nip it right at the bud, because most of the peddlers go to buy these drugs from the pharmacy shops. So we can, right from that point, break the cycle or break the chain. So pretty much that is what I think we can do to reduce drug peddling. And there's the law. If we can also use law enforcement to change this very bad picture. Thank you.
Thank you very much, from Madam Samfakra. I think we still have route number 3. Can you mute your microphones? Yes, can you please project row number 3? Sonia?
Yes, doctor.
Okay.
It's there.
Yeah, thank you.
I would request all attendees, please participate in polling 3. You just need to select the respective answer in front of the questions. And once you have completed the poll, then you have to submit it. I would request all speakers, please do not touch the polling. Out of 100%, it's 10% now. The graph is increasing. We will be projecting this poll for next 1 minute. So I would request all attendees, please put your answers. Thank you. We have received 50% of the voting. Still 50% is remaining. One more minute to go. Till the time, Dr. Mohammed, I would request you if you can just go through the participant with the questions and on the current status on the polling.
Thank you very much, Sonia. For the first one, are you interested in a career in global health supply chain? The answers here, yes or no, we have about 92% saying yes, they are all interested. I'm ready in it. Some people are already in it, about 7%, and 1% say no. How did you hear about us? Part 1. Through Pharmaceutical Society of Sierra Leone, 58% are saying through Pharmaceutical Society of Sierra Leone, and 27% are saying Empower School of Health channels. Some are saying University of Sierra Leone, 1%, MOHS, 2%, others, 12%. How did you hear about us? Part 2. Email, 30%, 33% are saying email. Social media linked, Facebook and Twitter, 40%. Others, friends at work, 27%. You are a member or alumni, staff of can choose one more than one option. University of Sierra Leone, 34%. Empower School of Health, 14%. Pharmaceutical Council of Society of or Council of Sierra Leone, 64%. FIP, 8%. Others, 22%. Have you taken any courses with Empower School of Health? Can choose more than one. 2% face-to-face courses. Certificate courses, 18%. Diploma, postgraduate diploma course, 11%. Not yet, but I'm interested, 71%. That's very good. How did you find this webinar? Very useful, 91%. Somewhat useful, 9%. Not useful, 0%. Very useful. Over to you.
Thank you, Doctor. Thank you all for your participation in poll 3. I would request Amara, if you can just speak on few words, and we will just proceed with the closing of the webinar along with the panel. Also, I have posted the link to download the certificate. I would request all participants, please download your certificates before leaving the session. Thank you. Professor Andy.
Yes. Thank you very much, Sonia. And I mean, it has been a very exciting webinar. I mean, a lot of experiences and knowledge has been shared during this 1 hour 30 minutes that we were here together. And I mean, the perspectives were different, but the focus and the aim of the webinar were the same. And so I want to thank you very much, Empower, for the collaboration and also helping us to set up this webinar. And also thank colleagues who joined in from outside of Sierra Leone. We appreciate your time and efforts to participate in this, even though we know and that one way or the other you also might have benefited from the sessions or the issues that are presented and discussed. A lot of comments, questions, and we are sent into the chat box, and the panelists tried as much as possible to go through them. If you have any further questions, please don't forget to send them. And Sonia just send the email that if you want to send your comments or questions. So we look forward to the continued collaboration. Thank you also very much to our colleagues back home who took their time to participate, and will continue to keep you updated to the courses. And also just to inform you as well, within Sierra Leone and the PSSL is also joining hands with Empower to ensure that these courses, colleagues who are interested here also pursue those courses, be technician of pharmacist, technician or pharmacist. Please, you can contact the society secretariat, the secretary general, or myself, the VP2, so we can guide you through the process and get you engaged with Empower so you can pursue your course of interest. So having said that, I want to thank you all on behalf of the president and also the general membership and the executive of PSSL. I want to thank you all for joining in. Thank you very much. Many thanks to the moderator, Dr. Bawo. I mean, you actually say lots to and thank you very much for that. And thanks to the panelists. Professor, thank you for your time. Dr. Batima and also Mada, thank you very much for agreeing to participate in this. And Sonia for hosting it. PSSL, thank you all very much.